mini stroke is a common expression that people use for what is more formally called a transient ischemic attack. A transient ischemic attack refers to the fact that it is temporary, it's transient, by definition lasts less than 24 hours, ischemic in that the presentation is based on decreasing blood supply to the brain. That's why you're having that event. And the attack is the description of the event, like the loss of speech, loss of vision, loss of strength, loss of sensation. People are often not sure what's happening to them. They lose vision. A gray area comes over their eye temporarily, or they can't speak for a matter of minutes or an hour, or they become weak or numb in one side of their body. Those are common presentations for so-called mini strokes. Any of those mini strokes are warning signs that something is allowing clots to block arteries or something else blocking arteries. If you have one of those transient ischemic attacks, even if they completely resolve, don't excuse them. That's a warning sign that you need to be evaluated for a source of stroke. They predict full-blown strokes in individuals. When you've had those warning signs, wisdom dictates that you're evaluated. Usually that initial evaluation is an ultrasound examination to look for the most common source of strokes, which is in the carotid artery. About 75% of strokes are due to disease in the carotid arteries, 25% are due to disease in the heart. So an ultrasound examination will evaluate the carotid arteries first. If you find significant blockages, then you consider the treatment options. There are mainly two. One is an open surgery, a so-called carotid endarterectomy, where you open the skin, dissect down onto the artery, open the artery carefully, take out the blockage, and reclose the artery. The other strategy is to do, through the vessels, placement of a stent, which involves, again, the use of tubes in the artery, the use of stents, which is a metallic frame placed inside the blockage and expanded to reopen the artery and blood supply to the brain. EIRMC is a hospital that has been certified as a primary stroke center, and so they have the tools and the personnel to have this immediate intervention to these strokes and minimize the impact of the stroke. My societies have been trying to encourage people to develop those tools and that personnel, but frankly this institution here is probably the one that has the tools and the personnel to handle the region which is appropriate.